Hi, I'm Dr. Boss Katzenaris of Next Level Wellness Center, and we're going to be talking today about jumper's knee. What it is, how you fix it, and how do you prevent it from coming back again. So, for jumper's knee, it's a fancy term for patellar tendonitis, which is an even fancier term for inflammation of the kneecap. So, jumper's knee is basically inflammation of this area right here. Your quad muscles, which means four, originate in this area of the hip and insert into the kneecap. Then the kneecap has a tendon that inserts into this bone right here called the tibia. And what ends up happening is when you get overuse, the muscles pull and tear right at the insertion, causing inflammation and scar tissue. Typically, it's people that jump. You've got volleyball players, you've got basketball players, long jumpers, high jumpers, people that use a lot of force with their quads and they're pulling, creating tension and pressure in this area. One of the main things that we have to worry about with the quads is proper quad hamstring balance. So you don't want to have too big of quad muscles, which are pulling and tugging too much, and weak hamstring muscles. So a lot of times people that exercise and work out, they go straight doing quad knee extensions, lunges, and a lot of quad dominant type of exercises and actually neglect your whole posterior chain. So doing a lot of glute strengthening exercises, hamstring, and even calves will actually help prevent a lot of the imbalance and a lot of the problems of your patellar tendonitis. Another way to prevent jumper's knee is through stretching, foam rolling, and strengthening. I'm going to show you some stretches and some foam rolling exercises to do to help alleviate and prevent your jumper's knee. So here's some stretches that I would recommend for any kind of lower body pains, aches, from hip to knee to low back to calves. So go ahead, let's have you lay on your back. So whether it's a couch, table, your bed, find a surface. You can even do it on your floor. So one of the things that I would recommend is to go ahead and bring your foot over your knee, and then go ahead and bring your knee up to your body and your chest as much as possible. And that's going to work on the side hip muscles that help relieve a lot of the pressure off the knee. Now, go back into normal, lay on your side. So one of the things that I also want to recommend is go ahead, grab your knee, bring it all the way up to your chest. That's going to help loosen up the low back and the muscles of the hip. But more importantly too is now bring your knee down at a lower angle all the way up, which is going to work on the glute muscles, your glute med, minimus. That'll help out with the hip. Besides stretching, another important tool to use is a foam roller. $25, and this will last forever and will help you with all your aches and pains, whether it's upper body or lower body. So I'm going to show you and demonstrate how to use a foam roller for your lower body. So go ahead, lay on your side, and we're going to work on the hip muscles. And so on the involved side, you're going to lay down, bring your opposite foot up, laying face, laying on your side, and you're going to roll all the way up from your probably mid-thoracic region all the way down to about the lower part of the leg muscles, about your mid-femur region, so scoot all the way up. So starting at this point right here, and then move all the way up to your, perfect. Now, one of the other muscles that we want to focus on is, go ahead, bring your leg up, and by bringing your involved leg upward, pointing upwards, you're going to now activate the glute medius and minimus muscle to help work and treat that area. So while you're in this area, go ahead, lay on your back, face up. One of the most important structures that you always have to relax and get flexibility and movement is your thoracic spine. Whether you have low back pain, shoulder pain, upper back pain, even knee pain, getting that thoracic spine, which is your rib cage, which is rigid and sturdy, we need to loosen that up, and the foam roller helps do a great job loosening up those muscles. So put it down here vertically or horizontally, and go all the way up and down as far as you can, up towards your lower neck region all the way down to the lower part of the rib cage.